I'm Alina, your insurance jockey, also with Medicare Portal. Let's talk about authorizations within Medicare or individual under age 65 health plans. Prior authorization is when a plan provider requires their consumers to obtain approval before receiving medical services. Services that are commonly reviewed under prior authorization are durable medical equipment, mental health, non-emergency ambulance use, home health procedures, lab tests, skilled nursing facility stays, inpatient hospital stays, some surgeries, and some of the more costly drugs. Plans will use prior authorization for care or for services that are typically associated with significant medical needs. These procedures or care are higher in cost. Prior authorization is also used to prevent fraud for services that have been prone to fraud in the past, such as durable medical equipment and home health care services. According to the Kaiser Family Foundation, 70% of Medicare Advantage plans require prior authorization for durable medical equipment, Part B drugs, skilled nursing stays, and inpatient hospital stays. And 60% of plans require prior authorization for non-emergency ambulance use, home health care services, and lab tests. In general, more than 50% of available plans require prior authorization for mental health services. While the benefits of prior authorization requirements include fraud prevention, controlling costs, and making sure services are covered by the plan, there are some serious detriments of these requirements, like increased administrative time and costs to providers. Also, as well as delays in providing care while waiting for the authorization to be approved. And sometimes these hassles and delays cause the patient to abandon the course of care. Or patients are forced to pay out of pocket and deal with insurance claims after the fact. This can lead to increased credit card debt, and not to mention the painful procedure of fighting medical bills. Luckily, there are several resources out there for consumers who need assistance in fighting medical bills. Original Medicare, in comparison to Medicare Advantage plans, historically hasn't required prior authorization, though recently there have been some changes to this policy. For example, now that some requests for durable medical equipment and provider services can be subject to prior authorization, overall though, Original Medicare has very few services that require prior authorization relative to the majority of Medicare Advantage plans that are sold out there today. As far as those folks on Marketplace, also known as Obamacare, HMO, or EPO plans, experiencing the prior authorization process may become all too familiar. This is why I recommend non-government funded health plans. Plans that allow an open access PPO with more freedom to choose your doctors, your hospitals, but keep in mind, you must medically qualify for these plans. Although these plans are not for everyone, it is important to talk to your agent about the different options. While Congress is working on ways to improve prior authorization process to increase efficiency and also to protect patient care and the ability of providers to deliver that care, it is important to understand the role of prior authorization requirements before selecting a Medicare Advantage plan or a under 65 Marketplace, also known as Obamacare or ACA plan. If you, your client, would like to learn more about the differences between Original Medicare, Medicare Advantage plans, Medicare Supplement plans, on or off the exchange health plans, please call or email me today. Don't forget to subscribe to my YouTube channel at Insurance Jockey, or check out my LinkedIn or Pinterest page at Insurance Jockey or hashtag Insurance Jockey. I'm Alina Marchant, your licensed health and Medicare insurance agent. Have a great day.